Namaste dosto. Today we will be discussing about something called as a second brain. Ever since the brain has developed in the humans, brain has actually developed to actually predominantly to process the things and less to memorize the things. This is very obvious from the ancient history of the mankind. As the brain developed, it was meant to process the immediate things, but to remember the past, it was actually not properly designed. However, the mankind has devised techniques to keep the things in a to remember the things. He has devised many more techniques. Of course, humans can remember some things, but the recall value or the recall percentage of the what we have read or seen in the past is definitely less. If you read, at least 80% of it is forgotten after the 6 months, and if you have seen around 40% of that, only 60% of it is forgotten and after 6 months. Like that, the capacity to remember things is very less. So the brain is actually evolved to process the information that is given, but not to actually recall. So recall capacity of the brain is less. Now, so this is very obvious from the history if you take. For example, if you go back to our own ancient history of Hinduism, where Vedas, when they were initially created, they were in small, verses were very small, because when the literature was not there, the way to write it. So the Vedas initially were very small, something like mnemonic, something like they were kept. As and when the capacity to write became more evident, the Vedas and later on what all came like Upanishads, they also become more elaborate, more detailed. This is what we can see. So the brain as such is evolved basically to process and less to remember. If you are asked to examine if you have seen a patient yesterday or day before yesterday, 1 week before yesterday, you may not be able to recollect everything what you have seen in that. The moment the information or the case sheet is given to you, you start processing the disease properly and you can come to the conclusion. So one thing is very clear from all these things: our brain is good at processing things and less efficient at remembering things. Now imagine, with the help of the artificial intelligence, can we bridge this gap? Can we create a second brain such a way that you can remember things when you are most required in the interface that you are operating in? For example, now you have seen a patient yesterday, that patient comes to you next day or a month. If you see the patient, if you can immediately remember all the past history of the patient, what all went wrong, what are the side effects the patient developed, what was his creatinine value, what was his ECG findings, what was his CT scan findings, what all. If you can do it automatically without much effort, don't you think it will be much more wonderful? I think so. That is the most important thing. Now, the engineers are already working on this project like second brain, but of course their implementation of second brain is to do things, to do like in the marketing or the next plan of design and all that. What is left, they are doing those things in their capacity. But we as doctors also need this second brain, which is actually very much important to us, because the medical literature is very huge and it keeps changing very fast, and to keep a track of on it is very difficult. Now, if we may devise a mechanisms which can get connected to our brain as like a second brain, and it comes to serve your purpose when it is most required, it will be wonderful. Imagine now in the coming days, if you are wearing something like a Meta glass or a Google glass, you see the patient yesterday. All the data what you have seen in the patient is gone back to stored in your second brain. Now your primary brain may not able to remember everything, so it go back and wax it back in your second brain, where next time when the same patient comes to you, if your thought process or voice command or something like that, some sort of input from you triggers all the patient's data and just displays right in front of your meta glasses or in the computer or some interface. So the treatment or the management becomes very easy, and the chances of you getting into trouble or doing the mistakes comes down very drastically. If it is actually dealing with an emergency, the things comes to you very fast in a much easiest way. That would be fantastic. So engineers, what they have done is they are doing something like they have created a input box where they throw their ideas, and this input box is connected with a large language model, and the large language model could be your Claude or a Gemini or a Chat GPT or a DeepSeek, whatever, and this will classify your input thought into a database structured, maybe your projects, or it could be a patient in your case, or a diagnostic report in your case, or emergency case, whatever. You can classify them, keep them, and when the patient comes to you next time, if the when you see with a single thought or a single trigger, if the whole data comes to you concerned to that patient, that will be fantastic. These days are not far away. This is going to happen in very near future. The only the limitation is the hardware, how you want to interface the say streaming and coming back the data. The rest of the things like large language models can classify things very well now. They can do that. Only thing, how you use the hardware. It could be a Google Glass, or it could be a Meta Glass, or it could be wired into the brain itself. That will be in advance, or it could be anything, such a way that you can come out with a great easily you can treat the patient. This is the next future. Now this kind of technology, do you think it is very good, or will it cause much more problem to us? Does it cause any psychological problems to us? I personally feel it doesn't, because if you are wearing a spectacle or if you are wearing this one, you can always remove it out if it is causing some sort of headache. If it is deeply integrated into your nervous system, I don't know right now how it behaves, but the second brain connected with spectacle rather than the mobile, such a interfacing. Basically, what is this AI? If you look at the AI in some other purpose, couple of years ago, whenever you wanted to do something, you used to Google it. You used to go surf the web surface, check the multiple pages, find out what is right, what is wrong. Now you are having a chatbot where you type things, it goes and search and puts the things right in front of you. Now next stage, you input the patient data and it will search and mix up, match everything, and it will give you. Next thing is particular case, the particular diagnostics, particular line of treatment, everything get admixed and you are able to take a decision. So this kind of approach, I personally feel, will be the near future happening to the medical science. What do you think? Do you have any other further ideas on this? Please let me know. Please do comment in the comment box. Your comments are encouraging to us. Kindly subscribe to our channel. Thank you.